personal protective equipment.
Care homes.
And the capacity of the NHS.
Border policy.
Testing and tracing.
From lack of PPE to not locking down quickly enough, 151 pages of what went wrong with the response to COVID-19, what was done well and what lessons can be learned. It was not to point the finger of blame, the report says, but in fact a lot of fingers are pointed in a lot of directions. This Joint Select Committee's inquiry found pandemic planning, for instance, was based too closely on the flu model and not on other respiratory diseases like SARS or indeed coronavirus. It criticised the contain and delay strategy, saying the government was fatalistic, had accepted that herd immunity was inevitable. It said it was a serious mistake to stop community testing early in the pandemic. And it also exposed some major deficiencies in the machinery of government. It said the structures for offering scientific advice lacked transparency, international representation and structured challenge. The decisions and advice rank as one of the most important public health failures the United Kingdom has ever experienced, is the hard-hitting conclusion. On the other hand, the report says there were the vaccines.
The fact that, at the same time as we were making some mistakes over our handling of the first lockdown, those very same government ministers were authorising 400 million doses of vaccine to be bought, even though we didn't even know if it would work. That turned out to be something where we as a country led the way across the world.
There was praise for the former Health Secretary Matt Hancock unilaterally announcing a testing target of 100,000 a day.
100,000 tests per day.
Controversial at the time, but it galvanised the system, the committees decided. But Mr Hancock's protective ring around care homes, that did not stand up to scrutiny. At the heart of this, of course, is the people whose lives have been lost, memorialised on the wall across from Parliament. And the COVID-bereaved families for justice are angry that they were not called to give evidence to this inquiry.
We absolutely should do it as soon as possible, because whilst people are still dying, we need to be able to inform the decisions we make to save those lives. And ultimately, inquiries take a lot of time. It will be years until the findings of this inquiry are able to be put in place.
Safia Na's 68-year-old father, Zahari, died from COVID in February.
My dad's letter of vaccination arrived in the same post as his death certificate, which is a pretty visceral indication of the failures of this government.
The bereaved families want a public inquiry now, but the government is sticking to next spring. And there is a warning today from the World Health Organization against complacency.
There is this sense out there, crazily, frankly, that it's all over. Now, we've got some very good tools, things we didn't have at the beginning of this pandemic, the vaccines, but we haven't stopped the transmission. The United Kingdom, for instance, is number 2 in the world in terms of numbers of cases per week. The number 1 in the world is the United States. But both countries do seem to be filled with populations that somehow got it into their heads that it's over. It's not over until we've really brought the transmission down. It's not over until we've vaccinated all the highest risk populations around the world.
And today's report too warns that the pandemic is far from over. But it also asks the more fundamental question: why was the UK so much more affected than many other countries?
Victoria MacDonald with that report. And just before we came on air, I was able to speak to Professor Christina Pagel, Director of University College London's Clinical Operational Research Unit and a member of Independent SAGE, the group of scientists who throughout the pandemic have sought to broaden out the discussion around government policy and strategy. I began by asking her what she thought of the MP's report.
It's certainly quite damning about the early stages of the pandemic. And goes into a lot of detail about some of the mistakes that were made early on. It's actually surprisingly kind, I think, about lockdowns 2 and 3, which I think, by that stage we knew a lot about the virus, and I think in that sense a lot more avoidable than the mistakes that were made early on.
To what extent do you think we really have actually learnt any lessons at all from this? Because one of the things which I think foxes the ordinary person is we have a wonderful health service which has clearly had a terrible ride through the pandemic.
I'm not sure that we have learned any lessons. I mean, that's the sad truth in, you know, some of the things that the report highlighted from the beginning, which is kind of a lack of learning from other countries, a lack of a good test and trace and isolate system. That's still the case today. And we're still kind of in this British exceptionalism thing where we're not learning from what other countries are doing. And we now have one of the highest case rates in the world. I think one thing we have got better at is transparency, you know, that the SAGE reports and minutes are now released and they're very comprehensive. But that transparency hasn't carried over to some other advisory groups like the Joint Biosecurity Centre or JCVI, where there's much less transparency about decision making.
Do you get any sense then that we are at all prepared, either if this awful outbreak continues at this pace, or worse still, we have another that follows it?
I mean, we've got to be in a better position than we were. I mean, we just have to be on the basis that we've just lived through it. And one of the things that the report says, which I think is true, is that countries that had experienced the SARS pandemic in the 2000s and also the MERS pandemic a few years later were better prepared and implemented some things like mask wearing and contact tracing much, much earlier. I hope that we will do that in the future. I hope that we are better at making decisions under uncertainty and getting in a diverse range of experts to advise policy. So in that sense, I think we're better. I think also we can learn from the successes that we've had. We can learn from the success we had with the vaccine development and the vaccine rollout and making those kind of decisions. So I'm hoping that that would come through. But we are now in a situation where we have a weakened NHS. As you said, it's had a horrible time. Staff are exhausted, they're burnt out. And there's no real sign of a break coming. We know that social care is really struggling. So from the pure infrastructure, we're in trouble.
From your perspective, then, is it a necessity that the government has to be prepared to invest in the health service to ensure that they can rebuild?
Yes. I mean, it has to invest in the health service. It has to invest in social care, particularly for the elderly. It has to invest in public health. Absolutely. We have one of the weakest public health systems in Europe. That has to change.
But you say that. Do they know that?
They know it. Yes. Will they do anything about it? Well, I don't know.
Professor Pagel, thank you very much indeed for talking to us.
Thank you.